Good morning, everyone. Welcome to World Health News. I hope you're having a calm and peaceful Sunday. We have a full show for you. For about an hour, we're bringing the world experts in every field, and we're going to have talking about screening. We'll talk about a little bit about robotic surgery for colon cancer. We'll talk about whether you should be screening or not, and also my good friend Dr. Siegel just arrived, and he's going to be talking a little bit about Obamacare. Is it good for us or not? Are we better off now than 2 years ago? Are patients benefiting from this or not? And what are the issues? And we're going to try to break this. Clearly, the emphasis of this is mostly on men's health and women's health. Obviously, as a urologist, I look for topics that are healthy for you, and it's coming from international exposures. In Netherlands, there's a huge news coming in about the use of MRI and how we're going to use MRI-guided biopsy. And I'm going to be talking about that. We also have a great blog that just went up a couple of days ago. If you miss something, it's all going to be there. All the videos and pictures and information is going to be on samadimd.com. samadimd.com is our new blog, and we're going to be basically posting this. Now, why are we doing this? We used to have a men's health show, which was a little more focused. Now I want to bring in the experts, not only from U.S., but also internationally. We're going to have everything surrounding medicine, whether it's going to be medical technology, medical app, the business of medicine, and the politics of medicine. And we see all these hospitals are merging. We see urgent care coming up. Are we moving too fast? Is the quality of care changing? And what you should be doing as a patient to be aware of your health and be your best advocate. So let's get started. Let me just talk to you about, like, we've spoken about elevated PSAs, prostate cancer. We still have about 27,000 men die from this disease. And, you know, our old-fashioned random biopsy may or may not have been a good technique to detect this. Now, the latest press that came out even this week from Lenox Hill is that we have the only UroNav MRI-guided biopsy. And if you have any questions about elevated PSA, prostate or prostate health, you can call our center, 212-365-5000, 212-365-5000. We are able to use this MRI biopsies to find and target the lesion instead of randomly shooting across the prostate and miss the focus of cancer. We're able to detect them better. We're able to use the 3 Tesla MRIs, find out where the lesions are, and just focus on those areas. And that's what's going on in our center. This was based on a study of 1,000 men, and we're finding out that the MRI-guided biopsy results in 30% higher chance of finding aggressive prostate cancer, which is what's important. We don't necessarily want to know about those indolent prostate cancers, and that's the reason why we're using this MRI-guided biopsy. So if you have any questions, always call us, and that was a big, exciting news over here. Now, the biggest thing that made it in U.S. this week was about the link of prostate cancer and breast cancer. So if any of your first-degree relatives have prostate cancer, your father, brother have prostate cancer, that increases the risk of breast cancer in the family. Genetics plays a big role. We know about the gene BRCA1 and BRCA2, which is really important. So if your father have prostate cancer, the daughters need to be more aware and get the mammogram and get the screening done and making sure. Right now, we're having a lot of issues with guidelines and recommendations from U.S. Task Force. As you heard, there are issues with PSA levels. Should you be getting them when you're 40 years old, or should you be getting them when you're 55? And I hope that one day AUA, American Urological Association, will wake up and will really consider earlier screening for prostate cancer. We're finding out younger men coming in with very aggressive prostate cancer, and this wasn't the case when we had the old guidelines. Now with the new ones, we're catching the disease later. We're really finding more aggressive prostate cancers, and that cannot be good. And we also have Dr. Craig Wax, who is a family physician, who hopefully will be calling in soon. In fact, he's online. So let me introduce you to Dr. Craig Wax, who's a good friend. He is a family physician calling in from New Jersey. He is also known as a doctor of all media. He is pro-health, pro-screening, and he also has his own radio show on 89.7 WGLS FM in New Jersey. Dr. Wax, good morning. How are you today?
Good morning, Dr. Samadi. Thank you for having me, and greetings to your audience.
Thank you very much. All right, so you're the first line of place where patients come to see you. As a family physician, you decide whether you should screen or not, should you get the PSA or not, should they go for mammogram. What's on the ground level at the family physicians? What is the thinking, and what is your thought on this?
That's a great question, Dr. Samadi. In fact, I definitely recommend patients every year come in, no matter what the age. I see patients from 1 week of age all the way through to senior citizens and a hospice care. And I recommend every patient come every year for several different reasons. There's a lot of conflicting information out there right now. The government, the third-party payer system, Medicare, Medicaid, as you mentioned, the United States Preventative Services Task Force, everybody's looking for every reason not to pay for routine screening. But it's almost like taking care of your car. I mean, would you not change your oil every 3 or 4 months based on use? Of course you would. And yearly you would do certain things. It's the same thing with your body. Taking care of your body is a very, very important thing to do. In fact, it's the most valuable thing we have. Everything we have comes from our health.
All right, so just wait right there, because I want people to know if they have questions about screening to call our station, 877-970-2999, 877-970-2999. Let me explain to you why the government doesn't want people to get screening. I mean, cost obviously is part of it, but they're also worried that if you find cancers that are not really aggressive, they're indolent cancers, then they may not really affect the patients. We are overdiagnosing and we're overtreating. That's really the argument against screening. And of course, in the field of prostate cancer, they talk about incontinence and impotence. And if the cancer wasn't going to kill them, then we just ruined their life. My take on that is, we need to understand the PSA better. We need more alternative tests. We need to get better genetic tests and better surgeons. Train our robotic surgeons, our laparoscopic surgeons. If we have good outcome, then screening has a lot of benefits, and there's an art to screening. And what do you say about that?
Dr. Samadi, you're absolutely right. We're in total agreement. I do PSA exams, which are blood tests, prostate-specific antigen for anybody out there that's wondering why we're throwing around initials. I do digital rectal exams on all males. I start my screening by 50 years old, and if they have risk or first-degree family history, we start even younger than that. And it has to be individualized, based on a person. It can't be based on a guideline or a government rule. It has to be based on the person. But for your yearly physical, it's important, if you're a male, to consider whether PSA and digital rectal exam is right for you, with the information that your doctor can share with you and the information you've gathered yourself. And as you mentioned, the female component of all this, mammograms, breast exams, pap smears, that's also kind of come under fire, and wrongfully so. I mean, there should be a discussion back and forth, but ultimately it comes down to you and your physician. And that's another reason that yearly physical exams are important. It helps strengthen the physician-patient relationship, which is very important. It's a great time to catch up, as you know, Dr. Samadi, on your patient's history and your family history if they see you on a yearly basis, especially if they have risk. It also allows for a physician to check up all body systems, just like your car getting checked up, is the analogy that I'd raised before. Also, it's important to have a physician monitoring your lifestyle choices and options. Are you drinking too much coffee? Are you drinking alcohol? Are you smoking? Most Americans, I think at least half of us, are overweight, if not obese, and that's a risk factor for all kinds of metabolic problems.
Well, in this show,
disease.
Yeah, absolutely. Dr. Wax, sorry to interrupt you, but in this show, we're a big fan of coffee, and we've talked a lot about the benefit of coffee and also the fact there was a study last week about MS and also in Parkinson's and Alzheimer's. But you're right. I think, you guys are in the front line talking about obesity, diabetes, blood pressure, etc. One other question before we go for a quick break. Shortage of family practitioners. They want to bring nurse practitioners who they claim that it's as good as you guys. Now they want them to prescribe, diagnose, screen. What do you say about that? Given the shortage of doctors in the future.
It's definitely an issue, because as the government and third-party payer system tries to force physicians out, because we're expensive to create, Dr. Samadi, as you know, that we are at least 11 years in the making, and all of the time and money that goes into that, and nurses are probably a little more than half of that. And don't get me wrong, I mean, nurses are the care element in a hospital or inpatient healthcare center or a nursing home. They are the care element. However, I don't think they can do the same job as a physician can do because of the training difference.
Yeah, I agree with you. I think they're an important part of healthcare. But there are some limitation to what the family practitioners do, surgeons, and also the nurses. Completely different training. I appreciate you being on the show. We're going to have you more often. I know you are doing a lot of collaboration with Independent Doctor Association, and I appreciate your take on screening and giving your Sunday time to us. We're going to take a quick break, and when we come back, I want to talk about colon cancer. We talked a little bit last week, but what treatment options are available? We have my good colleague from North Shore LIJ in Huntington, Dr. David Rivadeneiro, coming in, talking about robotic surgery for colon cancer. And if you have questions, call 877-970-2999. And we're going to take a nice break with my usual music.